One of the challenges that I faced early on with performing sedation is just the simple fact of having accurate records. Everybody says that they want to have accurate records, but do they actually have accurate records? It's kind of hard to say because in reality, most of us that are sedation or anesthesia providers, especially those of us who are doing sedation/anesthesia and surgery, we're not the ones that are actually maintaining the record. Way early on, back when I still used to use paper for performing my sedation records, I had a nurse that was doing almost all of my cases with me. Every single sedation record was like a piece of art. They were beautiful. He put so much effort into it, and I was glad for him, and I could read everything, and everything was on the up and up. Until he decided to go back to school, and I had to find somebody else. And again, I superimposed thinking that everybody's going to be the same as him and everything's going to be great. And the next guy that came in was terrible. He was great as a clinician, but handwriting was off. His timestamps were off. I couldn't track his doses as well. I was not happy. And I realized I had a serious problem on my hand because the amount of time and effort it would take for me to harp on somebody to perform that record exactly how I needed it to be, I didn't want to be spending my time doing that. And that is literally the tipping point that pushed me to say, we've got to make something better. And I'm happy to say that situation turned into what's now Xchart.